I am honored to introduce our first speaker, Dr. Bradford. She is a physician scientist and a head and neck surgeon and reconstructive specialist who earned her medical degree from the University of Michigan, where she also completed an otolaryngology head and neck surgery residency. Dr. Bradford has engaged in very important scientific and leadership roles. As a physician scientist, she has been the principal or co-principal investigator on more than 30 grants and has authored nearly 300 journal articles and more than 20 book chapters. As a leader, she became faculty at the University of Michigan and performed multiple leadership roles as Executive Vice Dean of Academic Affairs, the Chief Academic Officer for the Medical School, Chair of the ENT program and co-director of the Head and Neck Oncology Fellowship. She oversaw education, global initiatives, faculty affairs, faculty development, diversity, equity and inclusion, and regulatory affairs. More recently, she was appointed the Dean of the Ohio State College of Medicine in October 2020 and serves as the Leslie and Abigail Wexner Dean's Chair in Medicine and Vice President for Health Science at the Ohio State Wexner Medical Center. Lastly, she is the new president-elect of the American Academy of Otolaryngology Head and Neck Surgery. Wow, who is better than Dr. Bradford to talk about leadership? Welcome, Dr. Bradford.
Good morning, everybody. Thank you so much for that amazingly humbling introduction. I'm so honored to be with all of you this morning and really honored to speak about leadership in the community. It's a fun and exciting topic, so thank you all for your participation this morning. So this is a fun topic, and as you know, it's a true honor currently to both serve as Dean of the College of Medicine at Ohio State, as well as President of the American Academy of Otolaryngology. I'm deeply, deeply committed to building communities, and I think our communities are local, as well as international. And so I hope that some of what we're talking about this morning is meaningful and relevant to the work that you are doing in your communities. And as we've said, I'm happy to answer questions. I want to make sure everybody can see my screen. Here, I'll just switch it to, can everybody see my screen? Great. So, really fun to be with everybody this morning and really look forward to learning from all of our amazing panelists. So I thought I'd begin asking sort of a question of like, why did I do all the things that I've elected and been blessed to do? And really, the reason for all of the efforts is to make a positive impact. And as I have reflected on what is that positive impact, and this is a statement that I've reflected on for 10 or 15 years, I've always thought that really it's on learners, on patients and families, and on the communities we collectively serve. And I think it's really important to ground yourself in the why of why you're doing what you're doing. And I think the communities we serve, as I've mentioned, are local, regional, national, and global. And so I'm deeply committed to all of that. These are framed in academics because that's where I choose to practice, but I think that these lessons are similar, whether or not you're in an academic role, a private practice role, a leadership role in a hospital, or a private practice. All of those roles for otolaryngologists are truly valued and meaningful. So otolaryngology and academic medicine and this field is hard, but it's really worth it. I will share that I have been a runner. I'm probably a little bit more of a walker now, but some days and weeks are hard. I always tell the residents at sort of the resident graduation ceremonies that the days are long, but the years fly by, and I can see, and it's kind of amazing to think about really, really long days, really long, hard weeks, but then suddenly years have passed and you sort of wonder, where did all the time go? So cherish every morning or every day, wake up every day with a positive attitude, even if you've been up all night, and never give up, because it's really that meaning and purpose that drive us. And again, meaning and purpose is ultimately the difference we make and the legacy we leave. So vision, mission, and core values are really, really important. I think as everybody on the call thinks about the impact they want to make, you want to make on your community, I think you want to think about the why and where you're going. What's that 5 or 10-year long-term horizon? And how will you measure success? And what are the core values? What are the core values, and what mission are you trying to serve? And again, you've sort of heard some of that about my perspectives, which is really to make a positive impact on the communities we serve and to focus on what matters. So I think as one reflects on what is the health of the community you serve and I serve collectively, I think we have to first assess what is the current state of the health of our community and what factors are responsible for the state of this health. What is being done about it by the health service system or even the community itself? And I think it's a fascinating time to think about these factors right now, because I think it's clear that the pandemic for all of us has highlighted health inequities and social determinants of health, which are very, very real. What more can be done? What is proposed and what is the expected outcome? And this is really just a framework for you to think about impacting the communities that you serve in. And what measures are needed to continue monitoring the health of your community and the effect of what is being done. So, and there's a couple of references here that you might find useful. So social determinants of health. And I think that we are so much more aware of social determinants of health. And I've learned, this has been a learning journey for me, and the beauty of our field and our specialty is I learn every single day, which is a fabulous thing, and it keeps our minds and brains active. But what you can certainly read the quotes, but the reality is in the United States, and even in the local community that I live in right now, here in Central Ohio, your zip code is the biggest factor, which is just your local area. Your zip code is more predictive of your life expectancy, as well as infant mortality rates. And what that tells us is that the communities we live in make a huge impact on our health. And so inadequate housing is one of the factors, and that leads to challenges with lead levels. Everybody perhaps, many may know the lead crisis that impacted Flint, Michigan. And again, infants impacted by that crisis are still going to be struggling for many years, asthma and other respiratory conditions. And I think, again, with the challenges made more acute by the pandemic, food insecurity is a gigantic challenge that we collectively face. And how can we what can we do as otolaryngologists and physicians to impact food security and healthy food choices? Because food choices contribute to chronic illness. And chronic illness does impact our field as well. We're not alone. So respiratory conditions and food insecurity, things like sleep apnea, ear infections, respiratory infections, sinus infections. So really, this is very relevant and important to our specialty as well. I find this to be a really fascinating slide. You'll notice that the United States is in the middle, and the light blue bars are the proportion of the gross percentage of the gross domestic product, how much money we spend by country on both healthcare, and you can see significant expenditure in the United States on healthcare, and you can see all the other countries, whereas by relatively lower expenditures in the United States on social care. And social care is probably where these social determinants of health are real factors. And so you can see that it really varies country by country based upon policy and governing bodies. So I just find this a really, really interesting slide for us to collectively reflect because what is happening in the community that I currently live and serve is maybe very different from what's happening in the community the people on this call are experiencing. So what are some strategies about building community? So leveraging existing relationships, engaging. So this is not about us telling communities what to do. This is all about partnership, building partnerships and engaging people that live and work in the community that you are serving in. Find partners, build networks of people, and building trust really takes time. Address social determinants of health, not with a knowledge of what should be done, but really by engaging those community partnerships that are so valuable. And co-author that work with the people that you are working with in your community. And remember that cultural competence is recognition and humility is action. And this is a pretty interesting slide that talks about a lot of education, transportation, housing, employment, health services, income and wealth, physical environment, public safety. So all of these factors make a difference in community-driven solutions. So as you've heard, I'm the relatively new dean of the College of Medicine here at Ohio State and vice president for health sciences. And I thought I would just, as just some examples, share some of what Ohio State University is doing right now in Wexner Medical Center. And so we have robust relationships with what we call FQHCs, which are federally qualified health centers. You can see the picture of a community care coach mobile unit. So we actually bought a coach to drive into the communities and provide mobile health care. We have a robust health equity curriculum for our learners and are actually pondering whether we ought to elevate that and create a chief health equity officer and institute, because health equity, again, is so important. For addressing food insecurity, we have partnered with the Mid-Ohio Food Collective and are considering opening a community center and food bank close to our East Hospital. I'm going to talk about a Center for Primary Care and Innovation and Transformation. We're improving access to primary care for patients. We did a COVID-19 Mask Up campaign, and we have basically drive-through COVID-19 community-based testing sites. And we've made a $10 million investment to Pact, and I'm going to talk a little bit more about that. And so people not familiar with Mid-Ohio, and I'm still learning, the Columbus Near East Side is a underserved community where we have a hospital. So Pact stands for Partners Achieving Community Transformation. And this was formed in 2010 to develop a transformation plan with the community surrounding our Ohio State East Hospital. And the plan really focuses on both a physical and program development. And we really built a blueprint for community investment through extensive community engagement. And this really is a holistic approach to addressing social determinants of health, including housing strategy, this cradle to college career education pipeline, and a focus on community wellness. And I'll be honest, I'm really proud of the work that's happening right now at Ohio State. So here are some of our signature programs. Employee home ownership incentive, because we are an employer of thousands of employees. At Wexner Medical Center, we have nearly 30,000 employees. Exterior home repair grants, health science academies, economic mobility, so helping people through education and employment have mobility in the economics locally, develop safe, vibrant neighborhoods, really build community culture and identity, and through federally funded grants, leverage redevelopment and reinvestment in affordable housing for our community members. Oops, let me go the right way. So it looks like I might be finishing a little early, but that's okay. That'll give us a little more time for questions. This is a picture that is a little longer ago, but this is my family. And as I leave some messages and take-home messages, again, leaving a legacy. Why are you here? What are you here to do? Make that positive impact. And you want to do that with your family, with your patients, with your colleagues, with your trainees or learners, and with your communities. And I'll share a little bit of a story about my family. This is my husband, Dave, and we've been married since before medical school. I will say, I think that's about 38 years, and yes, he has put up with me all these years. My oldest son, Taylor, now lives in Big Sky, Montana, where he works as a IT or computer science professional. He lives on a beautiful mountain. And my daughter, Morgan, who probably is one of the people that taught me a lot about social determinants of health. She's now a first-year medical student, but she spent 2 years working as a medical scribe in the community of Minneapolis, St. Paul, and was really deeply impacted by patients who, for example, couldn't have access to insulin despite having, because of the cost of insulin, and how that really impacted their longevity and their health. And so she's a huge, a huge advocate, as I am, for addressing health inequities and social determinants of health. So honored to spend this time with you this morning, and honored to serve as the president of the American Academy of Otolaryngology Head and Neck Surgery. It's a fabulous organization that's really, again, our vision statement is to be the global leader in optimizing quality ear, nose, and throat patient care. And thanks for all you do to advance this vision for the American Academy. Thank you. Let me stop sharing.
Thank you very much, Dr. Bradford. So I guess we'll start the session for questions after this talk. One of the questions that I see here is, what have been the main challenges you've faced when you've tried to reach out to communities?
Can you repeat the question? I'm sorry.
The main challenges that you've faced throughout the years.
In trying to reach out to communities, there are many challenges. Let me just, first, I think it has to be a priority. So it has to be part of your vision and mission. Secondly, you need to have resources. And so when we think about resources, monetary, personnel, time, space, all of those things that I've always find are rate limiting step. So making the commitment. Then the third barrier, I think, is rather than the relationship being, well, I have all the solutions as, the physician or the otolaryngologist in the community, and then just walking in with the solutions. The concept is really that community partnership and engagement. So reach out to community organizations, reach out to people who live and work in the community, because the understanding of the challenges that people face is critical to have the right solutions to address the community need. Because if you think it's A and it's really B, it's not going to help. And I really think, suffice it to say that there's been a lot of attention in the United States to diversity, equity, inclusion, health equity, and anti-racism. And I would add that there's really been, I think, a greater understanding of structural racism and what that really means is the structures, the policies, the programs in the country haven't really allowed people to have an equal opportunity for success. And equal opportunity for success really means, do you have a roof over your head? Do you have access to healthy foods? Do you have an opportunity for education? I think we can never underestimate the impact of education on communities. Do you have mentorship? Do you have role models? Do you even know that success, becoming an otolaryngologist, is a possibility? And so I think, and that's why that community, so there's so many barriers, but I think what we have to come out of our offices and our hospitals and actually walk into the communities, partner with the communities, and listen and learn. And that's real partnership. And I think I will add that I believe another solution and a barrier is the diversity of our own profession. And so we need to diversify the field of otolaryngology.
Thank you so much. There is one more question. It's like a double question. It says, how do you establish the communication with the community, and how do you identify the leaders you should be reaching out in the community?
Those are fabulous questions. So I'll begin communication. One of the many things I have learned throughout my career journey is that you cannot over communicate. And I'll just throw out a number, and that is, if you want a message to be stated, you have to say it 7 times in 7 different ways. So an email, a newsletter, verbal, a slide deck, then repeat it all again. And so we have to really be effective communicators. And so, in my roles, I have, I'm blessed to be surrounded by really expert communicators who help advise me on communication strategies, both at the academy and again in my academic leadership roles. And so I think how we communicate is really, really, really important. And there are various stakeholders. So let me, so in addition to the communities we serve, it's also, how do I communicate with the students? How do I communicate with the faculty? How do I communicate with patients and families? And so, and I think having a lens, again, how you're communicating. And so I will be honest that this deep commitment to diversity, equity, inclusion, and how important it is for us to engage with our community is a message. I am fairly new here to Columbus. It's been a really busy 3 months, and suffice it to say, it's so different because it's not like normally what I would say is I would be out there in this community, but again, there are no social gatherings. And so it's been much, much harder right now. But what have we done? We do have a Healthy Community Day where we provided both flu vaccination and COVID testing. And so what I did, again, this is my first month, here, I literally went out to this, and it was at the East Hospital Center. And again, it wasn't, people couldn't get out of the cars, but I felt it was really important to be physically present and show my commitment. I would say my other tactic and strategy is, as a new person to a community, learn the people in your organization who know the community partners, and then have them bring you along to meet all those community partners. And I would say, for me now, that includes government relations. So we should not underestimate partnership with our governing bodies and our policymakers, because policy matters, but also those members of, again, the Ohio State community who are very, very deeply engaged in the community partnerships. So we've got a whole bunch of people, thankfully, that are deeply engaged. And again, as soon as we can go out, because I actually think the human part of this interaction really matters, but be part of the Zoom calls, be part of the investment and the partnership, and then rely on the people that know the community. So it can be churches, it can be all sorts of community organizations, and go to the neighborhoods. Again, it's this East neighborhood, and I'm, again, really proud of the work we do. And I definitely know the people who will introduce me in person to all these key partners in our community that we have. I think the second was the leadership question. How do you identify? Can you tell me the second half of the question? Because my first answer was pretty long.
How do you identify the leaders you should be reaching out to in the community?
And again, I think it's almost the same question. So first, I think you find the people in your organization who have real expertise in this space, and then rely on them to help you identify those community partners. And they are out there. They, so in my example, it might be the government people. It might be the people running the food health banks. It might be philanthropists. It might be churches and other community organizations. So I think it's a complex question, but I think it's never clear, right? So you have to really go out in the community and then ask, when you're out in the community, who else should I be meeting and talking to help advance health equity?
Dr. Bradford, great talk, amazing and very inspiring for our young international physicians. I had a question. What are some of the things that you did early in your career that you may be able to share with our international young physicians that maybe prepared you for some of the amazing leadership opportunities that you're now been blessed with? And that's the first question. The second question is, how much of this, these leadership skills do you think are innate? A lot of people may think, well, I don't have these leadership skills. I could never do something like this, but versus learned. And what are some of the ways that you can learn these leadership skills as a young physician?
Thank you, Mark. Great questions. Are leaders born versus made is a fabulous question that I've pondered throughout my career. I think I've always had an inclination for leadership. I have no idea why. I was, student council in medical school. I think I was student council in elementary school. I mean, whatever, and I think even as I started my career many years ago, I'll date myself, 1992, well, I was the chief resident even before, like 91, 92, I was the chief resident. And I think I don't know why, except I always saw what was happening and always said, boy, let's try to make this better. What can we do to make it better? How can we have a bigger impact? How can we be more inclusive? How can we provide better care? How can we provide better access? And so it's just, I think for me, it was a bit innate, but I would also say I'm very, very blessed to have been provided tremendous leadership development education programs. Michigan early on had a healthcare leadership institute. I went to the Global Institute for Leadership Development. The Academy has had leadership development courses that I've been an active participant in and very grateful for. And I also finally did executive leadership in academic medicine at Drexel University, which is specific for academic leaders in female academic leaders in medicine or healthcare. And so I've been blessed, and in all of those, I've learned a great deal. I would also say I have had, when I've had new leadership opportunities, I've also had executive coaching. And I think one theme I would say is you never stop learning. Great books, I have at least 100 leadership books. Some of my favorites are Good to Great Social Sectors. It's a really quick read, and I think it has a lot of principles about good leadership. But I think every day is a journey to become better and to learn more. And leadership development is a lot about learning not your strengths, but actually your weaknesses and how to address your weaknesses. And again, what was your second question, Mark? Your great questions.
I think you answered I think you answered both of them. The first part of the question was what kinds of things did you do early in your career to help prepare you for these amazing leadership opportunities, and you talked about some of those that you've done along the way. So amazing story and very inspiring. Thank you, Dr. Bradford.
Thank you so much.
We have one last question before we go to the next talk. Is how do you keep your resilience with everything going on?
That is the best question of all. And I have to honestly say, I've had one of the hardest weeks, of my entire, there's a lot going on. We did last weekend the board of directors and executive committee for the academy, and then strategic planning all last weekend. There is so much going on in my dean role right now. So literally, it's been like from the crack of dawn, like my alarm might be going off at like 4 or 4:30 a.m., which I'm not a morning person, and maybe even being in the office until like 8 or 9 o'clock at night. So first, you got to stay committed to wellness. And again, after our session today, I've already told my husband we're going to go on a walk, because we have to eat healthy. And we have to keep our physical presence. I think we have to continue in this pandemic to engage with family and friends. And I think, and I also think, vigilance, it's for me, it's really been about meaning and purpose. And I think when I actually think wellness, I'm a huge advocate for wellness, and I'm very much looking forward to Dr. Wei's talk. But I think meaning and purpose is actually a pretty good antidote to lack of wellness. And when you know that you're trying to make a positive difference and a positive impact, somehow there's energy to do all this. And again, being motivated to make a positive difference, do the right thing for the right reasons every day, for me has been a real inspiration. And again, what keeps you doing, those cards you get from a learner who says you changed their lives, or a patient or a family, I've made a big transition and the cards keep coming in. So again, it's a privilege and a joy to serve. And again, we can do, it gets to that slide, you can do anything that means a lot to you, and you can do it. So it's a privilege to have this time with everybody. Thank you so much. Thank you to the leaders who have organized this event. Thanks to the leaders from the Academy who are amazing, and to the leaders of the International Forum. So thank you so much. It's a real privilege.
Thanks to you, Dr. Bradford. It was an honor to have you with us.